All right, let's just jump right in. If you're prepping for the NCLEX, or honestly any nursing exam, you totally know that feeling, that panic when you're trying to cram a million different lab values into your brain. Well, guess what? Today, we're giving you the ultimate study hack. This is going to lock these numbers in your head for good.
Yeah, does this look familiar? Just a sea of numbers, right? All these ranges and values that just blur together, especially right before a huge test like the ATI. It's probably one of the biggest stressors for students, but listen, it really doesn't have to be that way. Because what if I told you there's a way faster, way easier method to not just memorize these, but to actually get them? You can forget the flashcard fatigue. We've got the cheat codes right here.
Okay, so let's start with the basics, just nailing down the normal ranges. We're going to move pretty fast here, so get ready. I promise these little tricks are going to make these numbers stick in your brain.
First up, we've got sodium. The number you absolutely have to burn into your memory is 135 to 145. Now, here's the trick. You see the pattern here? Just think odd numbers. 1, 3, 5. Got it? Then just bump that middle number up by 1 to get 1, 4, 5. It's a super simple rhythm for our saltiest electrolyte. 135, 145. Easy.
Next up, potassium, or K+. Its normal range is 3.5 to 5.0. So what's famously packed with potassium? Bananas, of course. The mnemonic is just that simple. When you go to the store, you're buying a bunch of bananas. How many? Well, about 3.5 to 5. You'll never forget that again.
And now for calcium, with a normal range of 9 to 11. This one is brilliantly simple and kind of dramatic. If your calcium is way off, it is an emergency. So what do you do in an emergency? You call 911 for calcium. It's urgent and it's super easy to remember.
Okay, how about magnesium? The numbers are 1.3 to 2.1. And yeah, that seems a little random, right? Well, not if you just picture a little toddler named Maggie. And how old is she? Oh, she's a little over 1 and just about 2 years old. Maggie is 1 to 2 years old. Simple as that.
All right, let's keep it rolling with chloride. The normal range is 98 to 106. For this one, I want you to think about a swimming pool. The absolute perfect temperature for a nice, relaxing dip in a heated pool. It's somewhere between 98 and 106 degrees. So just think chlorine in a hot tub.
Now let's talk about phosphate. The normal value is 2.5 to 4.5. This one's a gimme. Think of PHO, as in your smartphone. How much does a cheap little phone case or some accessory cost? Maybe $250 to $450? PHO-NE, 2.5 to 4.5.
All right, a key kidney lab, BUN. The range is 10 to 20. And the memory trick is literally right there in the name. Just think of hamburger buns. When you go to the grocery store, how many come in a pack? Usually somewhere between 10 and 20. Perfect.
And of course, bun's partner, creatinine. This range is super low, 0.6 to 1.2. For creatinine, all you have to remember is that a normal level is low and it hovers right around 1. It's a tiny range, but if you can just remember that it's low and centers on 1, you're all set.
Okay, so we've got the numbers down, but here's the really crucial part for your exams and for keeping your patients safe. It's knowing why these numbers matter. So let's look at what happens when things go wrong with the brain, the heart, and the muscles.
Now this slide right here is like our master key. Generally speaking, I want you to think of high or hyper states as being big, dry, or maybe overly calm. And for low or hypo states, think low, slow, or twitchy. This right here, this is the foundation for everything that's coming next.
So let's apply that. When you think sodium, I need you to think neuro, brain changes. High sodium, or hypernatremia, literally pulls water out of the cells. It makes things big and dry. This dries out the brain, and that leads to confusion and seizures. Now on the flip side, low sodium makes the brain low and slow, which also causes headaches and seizures. See the common theme? Sodium imbalance, it hits the brain first.
Now for potassium, this is the one you absolutely cannot mess around with. The mnemonic is blunt for a reason. K can kill the heart if it's too high. This electrolyte is all about cardiac function, period.
And this slide just brilliantly illustrates that point on an EKG. High potassium, hyperkalemia, causes these tall, peaked T waves. It's like the heart is overstimulated, totally wound up tight. Low potassium does the exact opposite. Everything goes flat and slow. You get flat T waves, weak muscles, and even a slow gut that leads to constipation.
Okay, let's move on to calcium. So if sodium is the brain,
And potassium is the heart. Then calcium is all about the muscles. Remember our rule? High calcium means high calm. The muscles are just too relaxed, and that leads to weakness and slow reflexes. Low calcium? The opposite. The muscles have low calm, which means they're excitable and twitchy. This is where you see those classic signs you'll absolutely be tested on. Schaffstett's sign, that facial twitch, Trousseau's sign, which is a carpal spasm, and even tetany, that's severe muscle cramping.
And just to prove these aren't some made-up memory games, this slide pulls these concepts straight out of a textbook. You can see it right there. Hypocalcemia is directly linked to tetany, Schaffstett's, and Trousseau's. These mnemonics are just super powerful shortcuts to the core clinical facts you have to know.
Okay, what about magnesium? I want you to think of magnesium as the great relaxant. It really affects deep tendon reflexes and the heart. So when magnesium is high, it mags everything down. Blood pressure drops, deep tendon reflexes drop, everything just slows. And when it's low, you guessed it, the opposite happens. Everything gets sped up. Hyperactive reflexes, a fast heart rate, you name it, arrhythmias.
And hey, remember phosphate? The key clinical connection you need for your exams is its inverse relationship with calcium. Think of them like they're on a seesaw. If you get a question where phosphate is high, you automatically know calcium must be low. And what does low calcium mean? Exactly, twitchy muscles.
All right, we've covered a ton of ground really fast. So let's put it all together on one final slide. This is your high-yield cheat sheet. Screenshot this one for a last-minute review.
Here it is, the entire second half of this explainer, all in one neat little chart. Sodium is the brain. High is big and dry, low is low and slow. Potassium is the heart. High is tall and peaked, low is flat and slow. Calcium is muscles. High is calm, low is twitchy. And magnesium is reflexes. High is magged down and low is sped up. If you can master this table, you'll be able to nail dozens of potential exam questions.
So, there you have it. You've got the cheat codes. Now you know how to quickly recall not just the numbers, but what they actually mean for your patient. The next step is to start thinking clinically. So I'll leave you with this question. Based on their super narrow normal range and their critical function, which electrolytes balance do you think is the most fragile? And honestly, the most dangerous when it's disturbed? Think about it.